Hello, and welcome. Today we're diving into a specific type of glaucoma called pigmentary glaucoma. This condition, while relatively rare, can significantly impact vision if left untreated. We'll explore what causes it, how it develops, its symptoms, diagnosis, and the ways we can manage and potentially prevent it. So, let's begin our journey into understanding pigmentary glaucoma. The primary cause of pigmentary glaucoma is the dispersion of pigment granules from the iris, the colored part of your eye. These granules, normally securely attached, flake off and circulate within the eye's fluid, the aqueous humor. This pigment release is often exacerbated by a condition called pigment dispersion syndrome, where the back of the iris rubs against the lens, scraping off these pigment particles. Factors that can contribute to this rubbing include certain eye shapes, like a concave iris, and even strenuous activities that cause the iris to vibrate more vigorously. The pathophysiology of pigmentary glaucoma is a chain reaction. First, pigment is released from the iris. These pigment granules then flow with the aqueous humor towards the eye's drainage system, the trabecular meshwork. Over time, the meshwork becomes clogged with this pigment, reducing its ability to effectively drain fluid. This leads to an increase in intraocular pressure, or IOP, inside the eye. This elevated pressure, in turn, damages the optic nerve, the vital cable that transmits visual information from the eye to the brain. This damage progressively leads to visual field loss, which, if untreated, can result in permanent blindness. Pigmentary glaucoma isn't as common as other forms of glaucoma. Estimates suggest it affects approximately 1 to 1.5% of glaucoma patients. It's often diagnosed in younger individuals, typically in their 30s and 40s, and is more prevalent in men than women. While it can occur in any ethnicity, some studies have suggested a higher prevalence in Caucasian populations. Remember, these are general trends and anyone can be affected, regardless of age, gender, or ethnicity. The symptoms of pigmentary glaucoma can be subtle, especially in the early stages. Many people experience no symptoms at all until significant optic nerve damage has occurred. When symptoms do appear, they might include blurred vision, particularly after exercise or activities that cause pupil dilation. Some individuals also report seeing halos around lights or experiencing eye pain. Because the release of pigment can be episodic, symptoms may fluctuate, making early detection even more challenging. Regular eye exams are crucial for identifying the condition before noticeable vision loss occurs. Diagnosis of pigmentary glaucoma involves a comprehensive eye examination. This includes measuring intraocular pressure IOP using tonometry. Gonioscopy, a procedure that allows the doctor to visualize the drainage angle of the eye, is essential to identify pigment accumulation in the trabecular meshwork. Slit lamp examination can reveal pigment deposits on the cornea, a characteristic finding known as Krukenberg's spindle. Optical coherence tomography, or OCT, is used to assess the health of the optic nerve and detect any signs of damage. Visual field testing measures peripheral vision and helps identify any areas of vision loss. Pigmentary glaucoma is a specific type of open-angle glaucoma where the angle appears open but is blocked because of pigment. Thus, it is not classified into further types beyond this. The goal of treatment is to lower intraocular pressure and prevent further optic nerve damage. The first line of treatment often involves eye drops that reduce fluid production or increase fluid drainage from the eye. Prostaglandin analogs are commonly used, but other medications, such as beta blockers, alpha-adrenergic agonists, and carbonic anhydrase inhibitors, may also be prescribed. Laser trabeculoplasty, particularly selective laser trabeculoplasty or SLT, is another treatment option that uses a laser to improve the function of the trabecular meshwork. In some cases, surgery, such as a trabeculectomy or the implantation of a glaucoma drainage device, may be necessary to create a new pathway for fluid to leave the eye. Currently, there is no definitive way to prevent pigment dispersion syndrome or pigmentary glaucoma. However, early detection and prompt treatment can significantly slow down the progression of the disease and prevent severe vision loss. Regular eye exams, especially for individuals with risk factors such as a family history of glaucoma or nearsightedness, are critical. Avoiding activities that cause excessive iris vibration, although difficult to quantify, might also be helpful. Protecting the eyes from excessive UV exposure with sunglasses is always a good idea for overall eye health. The prognosis for pigmentary glaucoma varies depending on the severity of the condition at the time of diagnosis and the effectiveness of treatment. With early detection and consistent management, many individuals can maintain good vision for a lifetime. However, if left untreated, pigmentary glaucoma can lead to significant vision loss and blindness. Recent research is focusing on developing more targeted therapies that specifically address the pigment dispersion process. Studies are also exploring the potential of gene therapy to protect the optic nerve from damage. Advances in imaging technologies continue to improve our ability to detect early signs of glaucomatous damage, leading to earlier intervention and better outcomes. Stay tuned to ongoing researches for future prevention and cures for pigmentary glaucoma.